Hello, everyone, and welcome back to the Nurse on the Go podcast. In today's episode, we have a very special guest named Earl, who is a new grad nurse who's recently landed his dream job in the pediatric intensive care unit. He has an amazing Instagram at TheRainbowNurse, where he advocates wellness, self-care, and aids hundreds of nursing students every day in doing great in nursing school, whether that is through his 101 career coaching, his in-depth helpful NCLEX study guide, his blog, and so much more. May you please help me in giving a very warm welcome to Earl. Hey, Earl, and welcome to the Nurse on the Go podcast. It's so exciting to have you on today. I know you have such amazing things to share with us, such as your journey in nursing school, post-grad life, and great things that you represent on your social media, such as wellness, self-care, and self-love. So I'd love for you to tell us a bit about yourself, such as the year you graduated and your program, and how your life is currently going as a new grad nurse, and all about you.
Yeah, so I graduated in May 2020 during this pandemic, which was kind of crazy. So we had like a Zoom graduation, and it was kind of up in the air if we were going to graduate or not because part of our clinicals had got shut down because of the whole COVID-19 thing happening. But luckily, I got my degree, got my BSN. So my program was a 4-year nursing program, and again, it was a BSN. And I went to nursing school kind of straight out of high school. So I didn't always know I wanted to be a nurse. So I had family who were nurses, and I had a couple aunts and uncles who were nurses. But nursing never came up into my mind until I started volunteering. So my dad worked at a hospital as a kind of a sterile processing technician. So he would like clean all the materials in the rooms for the surgeries. And I volunteered in their nursing administration office. And I got to meet nurses who absolutely love their job. So I applied straight out of high school. I got in, and our program was interesting because we did like 1 year of like the prereq courses, but we were already guaranteed a spot into the nursing program. So sophomore year, we started like our didactics and our clinicals, etc. I currently work as a patient care technician per diem. So it's really great because I get to choose when I want to come in. And I'm no longer seeking employment. I actually landed my dream job in the CVICU. I
Wow,
have a
that's
big
amazing.
announcement coming up. And yeah,
Wow.
I do love self-care and wellness. I really feel that as nurses, we deserve to take care of ourselves. And, I've seen this working as a tech, and I've seen this in clinicals, like just nurses who snack on chocolate, and, like get aren't really being mindful of the type of food that they're putting in their body because it's such a high stress environment. And I'm
Mhm.
really passionate about also helping nurses pass NCLEX and landing their dream job. So I actually have my own NCLEX study guide, and I also coach nursing students or new grad nurses and do one-on-one breakthrough sessions.
Yeah, so that was really amazing to learn. And what you do now for the self-care and wellness, I definitely agree with, the very stressful environment. And you just go to the vending machine and grab the first thing you see, and you're not really thinking about what you're putting in your body. You're just like, let me just satisfy my cravings and get back out there.
Oh,
So,
totally. And like, I just think of like, what is a reward from nurse managers when you do well on your unit? It's like a box of pizza. And
perfect.
it's like COVID crisis pay. It's like how many boxes of pizza we
Yeah.
received.
You're like, what's my limit? Oh, there is none. But yeah, no, definitely. It's a very good point. It's kind of like the reward system, and not only are you rewarding yourself, like I just had a really hard shift and I deserve this, but it's like other people are rewarding you. You're like, easy, let me just grab it and go.
Right. And there, it's not to say that you can't like enjoy those things, but I guess it's just being more mindful of, you know, as a healthcare
Mm-hmm.
practitioner and a provider, also looking out for your own health. Um,
Mm-hmm.
and yeah.
Your journey is so packed with a lot of different things. So I'd love to break it down into different segments, and we can begin by talking about nursing school and your journey. And I would love to know, how is your nursing school experience?
Yeah, so my nursing school experience was actually amazing because I felt I was really supported throughout. I had a bunch of friends, and I think the most important thing in nursing school that helped me was just having really awesome peers and people who would support me. So I have a couple friends who I honestly feel I can have done nursing school without,
Mm-hmm.
and just having those support people who are in the program, who are in the trenches with you, trying to do the same thing, trying to get your that um, license at the end of the day, and just having that person to talk to is super helpful. And from a logistics standpoint, like you have another person to study for those exams and
Mm-hmm.
to like keep you accountable for certain deadlines. And I feel like nursing school is just honestly a fire hose, drinking from a fire hose, and
Yeah.
sometimes it's just having that sort of um, feeling that, oh, someone else is going through this exact same thing. So that was definitely the best part for me, was just having that community and being able to collaborate with others. um, the hardest thing about nursing school was definitely the exams. Like you are definitely studying a lot more. So I actually had the luxury of not having to work during school.
Okay,
That
wow.
being said, I think it's much more difficult when you're having a part-time job, or you have kids who you have to take care of. And I definitely think that kind of finding that balance between your deadlines, like Google Calendar was like my lover. Like I
Mm-hmm.
just spent so much time with my Google Calendar.
Yeah.
I would wake up and like I would say good morning and say good night to it. Like it
Yeah.
was legitimately like, yeah, it was like a Taylor Swift song.
Yeah.
But um, I think just for me, the best part was definitely having that support and also having the opportunity to get organized.
I believe that statement about having other people around you, like having other people support you is one thing, which is amazing to have, but just knowing that you have other people going through it with you, and it's this unspoken connection that you have to them. You're like, I understand what you're going through, and you have this bond, and even when you're struggling, they know what you're going through, and it's just great to have such a great support system and friends that are always there with you, and they really do help you get through a lot of the stresses of nursing school, because it does get really hard many times. So it's just great to have such a great support system, your family and friends, and yeah, so that's great. I'm so glad you had such a great experience during your nursing school journey. And I really want to know too, like, just what was your favorite or maybe your least favorite class or clinical that you may have had during nursing school?
Oh my gosh. So, definitely my favorite class was mental health. And it's funny because I'm not even a mental health nurse, or my
Mm-hmm.
job has really nothing to do specifically with mental health, but I feel like
Mm-hmm.
I learned so much therapeutic communication skills and like those skills, you'll use them for life. And I
Mhm.
honestly feel like just having that awareness of social cues and social determinants of health was amazing. And granted, the class was kind of combined between community health and mental health, but I
Mhm.
honestly felt that those life lessons I learned working with vulnerable populations, but also kind of learning about things that we all experience, like anxiety and things we hear about in the media, like domestic violence, child abuse, elder abuse, and things like substance disorders. Like those are all things that we hear about in real life, and I just think that those that inside knowledge is just what makes you a nurse, is having this higher level understanding of the dynamics at play when it comes to mental health. And the favorite thing that I learned from that class was that the way you talk to your patients always matters, and the way you make them feel welcomed, and
Mhm.
that establishing that rapport like happens in the first minute. You
Mhm.
can have a patient like not like you just based off the way you communicate. And
Mhm.
that was honestly one of my fave classes. Still in touch with that professor. um, that being said, my least favorite class I would say was honestly um, would have to be um, med surge too. Not that it was necessarily um, like a bad professor, because he was an amazing professor.
Mhm.
I just felt like I missed that sort of humanistic way of nursing, and that like
Yeah.
human first. Whereas like with med surg, it's a lot about nursing interventions and kind of the more um, technical side of nursing.
Mhm.
And it was also kind of a hard class too. Um, so those were my like favorite pieces.
I've only gone through 2 years of nursing school, so I have two more to go, and I have yet to experience like labor and delivery and mental health, like you said, or med surge. But I really do feel like some people go into nursing school with a predisposition in their head, like, I'm gonna love labor and delivery, I'm gonna love mental health, and they kind of close themselves off to the fact that they may love something else too. And not many people end up going into the field that they thought they were going to initially go into. So it's just reminding myself that to give every single clinical a chance and to be like, oh, I love med surg, or see how I like mental health. But I'm really excited to see how every program grows, and I'm going to give everything an open chance, and we'll see where I end up. But yeah, so what specialty, I'm really curious to know, what specialty did you do for consolidation at the end of your journey of nursing school?
So I actually did my preceptorship in the pediatric intensive care unit. And I honestly fell in love with kids, fell in love with my kiddos rotation. But I also like the piece of just communicating, because I think that critical care is very much mental health, because you have families that are grieving. Sometimes a kiddo is not going to make it, or you're dealing with family dynamics related
Mm-hmm.
to kind of dealing with a sick child. And I kind of use my experiences in community health to land me a spot there.
Mm-hmm.
So wow, it was really intense. So we would get kids with you know ba- basic things like flu and like RSV, to more complicated things like um, shaken baby abuse,
Mm-hmm.
trauma, um, cystic fibrosis, exacerbation. So honestly, in the PICU, like you saw everything.
Mm-hmm.
And I really appreciated my experience, because I learned a lot about family dynamics. And with a lot of the kids that I took care of, it goes to show how involved family is in different ways in the healing of a child. I remember one child whose mom didn't want to breastfeed,
Mm-hmm.
and because of that, the child um, unfortunately wasn't receiving enough nutrition and had to be admitted. And we called those babies in the PICU like feeder growers, but
Mm-hmm.
almost all the time it's because of some sort of psychosocial aspect that's standing as a barrier for the mom um, to kind of take care of this child. So, in a lot of ways, like the PICU is similar to mental health, but like we're still pushing drugs, we're still, we have monitors, we have the vital signs on the screens, we have alarms set. Maybe
Mm-hmm.
we'll have like um, the kids' heart rate continuous. So we're watching them closely, and a lot of the times the kids are really sick.
Mm-hmm.
But I really love that I could kind of have best of both worlds. I could kind of have that empathy, compassion, communicating aspect, while also kind of using those critical thinking skills of like, oh, my baby's heart rate is like going to the 200s, like what's going on? And I really liked kind of the seeing everything. And most importantly, I also think when you're considering what specialty you should do, thinking
Mm-hmm.
about what you think will be most rewarding. Because, I think the ICU is super, super cool, but I didn't do it because I wanted to, like, get the most skills.
Yeah.
I really wanted to do it because I believe that kids don't deserve to be sick. That and me and my friend who are now in this new grad program together, we
Mm-hmm.
always talk about how we like to think us ourselves as giving the kids another shot at life.
Yeah, so that's all so amazing. And I really do believe that saying that it's not just in pediatrics, it's not just the kid, but you're also dealing with a whole family who is watching your every move and they really want the best for the child. And along with that too with pediatrics is you have such a varying age range. You can have a newborn from like or a really small baby from 6 months to all the way to 18 years old. So you're dealing with, you have to think about how you're going to deal in that situation and how your communication and your response to that patient will be depending on their age. And I think that it's a great experience. You do a lot of different things in pediatrics, and it really does give you an aspect on different things that can go on with anyone from a newborn to someone who's an adult. But yeah, so I think that's amazing. And do you think that nursing school prepared you for post grad and your experience as an ICU nurse?
Um, I honestly think that the didactic portion of nursing school prepares you, but the clinical portion is just so much more different because
Mm-hmm.
you call the shots. You're the
Mm-hmm.
nurse. You're no longer the nursing student. And I think when you're going through clinicals during nursing school, there's a lesser degree of sort of responsibility and autonomy. And
Mm-hmm.
is there's almost this like, okay, I'll just do what the nurse wants me to do. And you can also be proactive, but when you're, out in the workforce, I like to think of it as you do get to call the shots. And at the end of the day, like, um, you're the one who's responsible. And I think because of that difference in sort of responsibility and accountability for the patient, there's just so many more things that you need to do that you never really think of to do as a student. Like, I'm sure you've heard of nurses passing meds, etc. So those are the things that we would do during clinicals, but
Mhm.
included as your role as a professional nurse, you're going to be going to play a more active role in rounds, in, let's say, calling the doctor. Maybe if there's a project on the unit, doing something specific like checking all of the monitors to make sure they're working, or going through to see um, how many kids have a central line, and if they have a central line, when did they get their last chlorhexidine cleaning. So just different things like that that are added to your task list. And I guess you also kind of view it more as a team. So you no longer think about it as, oh, I have to take care of my X amount of patients, do this, but you kind of have this higher level of like, what can I do for the unit and how can I be a resource? So you definitely get more involved in sort of collaborating. And I guess I was shocked at first when I first kind of started, but it's been really, really awesome to have a more um, active role. And personally, my advice for nursing students in their clinicals is to just be more proactive, because um, when you're a nurse, you'll definitely have a lot more on your plate in terms of things you need to do.
Yeah, and I feel like maybe for some new grad nurses, it might be a little bit fearful to take that initiative coming out of nursing school and doing those clinicals. And during my clinicals, personally, it would be like, maybe I can't do this without the nurse's permission. So you would have to go run, get the nurse, and understand why you're going to be doing something before you do it. But definitely with nursing, you have to be very quick thinking, and you have to understand what's going to happen if you do something. And with nursing school and going to clinicals, you have such a limited amount of time in the hospital. And I know now, due to the pandemic, we get a half of the time for clinicals now than people would have anyways during regular nursing school. And maybe that wasn't even enough to begin with. Maybe they needed more clinical experience. But yeah, so I definitely could only imagine how it is in the beginning, definitely with more experience once after becoming a new grad nurse. With more experience in the hospital, you'll start to get the hang of things, and be really ready to take different tasks on and know exactly what you're doing. But yeah, so the next little category I wanted to go into was all about the NCLEX. And I know you have this NCLEX guide that all nursing students can use for the NCLEX, which is really amazing. And I was wondering, for you personally, how was the NCLEX?
Yeah, so I honestly thought that the NCLEX was okay. And
Mm-hmm.
it definitely is a culmination of everything you learn in nursing school. So, like your skills, your professional practice. But to be honest, I also felt like it was at sometimes random, and a lot of the knowledge um, that it tests, I think it kind of tests more of, do you know how to be a safe nurse? So personally, I created a study guide for myself because I was getting A, overwhelmed, and B, almost felt like there was no guidance. And people will always mention the Saunders book, but I honestly
Mm-hmm.
felt that Saunders was a little bit too easy. And it was definitely great for a content refresh, but a lot of the times I felt like the questions were a little bit more um, obvious. So
Mm-hmm.
I decided I'm going to make my own study guide, and I want to focus on content that I feel will be tested on. So I went ahead and did that, and it became about 150 pages long.
Yeah, I can only
And
imagine. Yeah.
uh, I basically reviewed from, um, so I started with OB. I basically did the lifespan. I
Mm-hmm.
started with OB, like when you're in your, so like prenatal, like when you're in your mom's womb, and I went all the way until old age, and I kind of fit community and mental health in the adolescent period because that's where
Mm-hmm.
you kind of see the mental health, and I kind of just went through that. And in addition to that, I went over, like, the nursing skills that make you a nurse.
Mm-hmm.
And it was really awesome to just review it. Now, my actual test taking experience was a little bit nerve wracking, um, given right now they are sort of doing tests with limited availability. But I like to tell people, and the people I coach, that it almost feels like jail because they'll tell you to put everything you have in a box to lock it up. You'll take a photo, you'll do fingerprints, and they pat you down, or they make you pat yourself down. And they're telling you the rules and everything. And I always um, tell my mentees to not let that part psych
Yeah.
themselves out, because I feel like once you start being anxious and you get to the computer and you're already anxious, that's when it kind of begins to affect your performance.
Mm-hmm.
um, and um, my last thing I would say about it is that definitely doing questions is super helpful. So I used UWorld, and I thought that was a great supplement. But I really want nursing students to know that you have to study content. And
Mm-hmm.
there's this misconception that, oh, I just need to do 2,000 questions and then I'm good. But I honestly felt like reviewing content was what kind of helped me pass. And also in my study guide, I kind of go over test taking strategies that I
Mm-hmm.
feel are, again, part of making yourself used to those NCLEX questions. So I personally studied for about a month and a half.
Mm-hmm.
And I think that during your last semester of school, a lot of nursing schools have like an exit exam. So I thought like just keeping that up was super helpful.
Mm-hmm.
And I think though that part of testing during the pandemic that was helpful was you just feel so purposeful. You know what I mean? Because
Mm-hmm.
COVID-19 is happening, we need nurses, and you just feel empowered. And
Yeah.
I almost felt like less anxious because of doing it during the pandemic. That being said, the test center was really good about just cleaning everything and um, making sure everything was sanitized before. And the one thing I will remember from my test taking experience was the guy who did my fingerprints was like, "Thank you for being a nurse and
Oh, yeah.
entering the profession during this pandemic." And I think that before going into that testing room, really focusing on your purpose and remembering what the higher reason for the NCLEX is to
Mm-hmm.
make sure that you're safe. Um, but also, going back to, okay, like these are the reasons why I became a nurse. And that really helped too during the exam when I started to feel like I was getting the harder questions.
I really love that you have a NCLEX guide because I definitely will have to use that once I'm graduating, having to write the NCLEX. But I love that you since you have done the NCLEX and you learned from your own experience, you wanted to help so many other people who have yet to do the NCLEX and let them know that this is what you should be doing, and the content, and not so general but more condensed, and have some really good questions that they may potentially ask you, because I feel like maybe for some students who are studying for the NCLEX, they go over a vast majority of information, some that maybe might not be useful during the NCLEX, but some that may. But with your NCLEX guide, it's very specific and it gets down to what you should be studying. And I love that you have it aligned from all the way when you're in the womb to all the way to different fields and classes. And I feel like that's really helpful to many students. And also with what you mentioned about going into the NCLEX and having that pat down and the fingerprint, I really feel like maybe for some that definitely sounds like a very stressful situation. It's like, am I going to do the NCLEX, or am I going to go into jail right now? But I really feel like that they already go into it really stressed, and for some it comes down to how you're feeling, and some might get tricked out by that. But I really love that you put some strategies in there to help them understand what to do during that situation and go into it with a good, clean mind that's gonna just do great on that exam. Yeah, so the next category that I'm going to go into is all about your new grad nurse life. So you just recently got a new job as an ICU nurse. So I'd love to know all about that. For example, what do you do as an ICU nurse, and what made you apply to become an ICU nurse?
Yeah, so I guess as an ICU nurse, you take care of really critical and complex patients, and critical care. I would define it as taking care of a patient with many different needs, but I also define it as the highest acuity in terms of care. So these patients are really sick. These patients could die. So when I did my preceptorship in the PICU, um, this was the unit we would send all of the kids from med-surg or hemonc or even the ER, where they needed the most kind of eyes on them. And
Mm-hmm.
um, why I was interested in critical care was I really enjoyed and appreciated knowing everything about my patient, knowing their history, their background, um, absolutely everything. And I felt that because you're focusing on those 1 to 2 patients, you get the time to really advocate for your patients and
Mm-hmm.
know their needs. Unlike med-surg, where sometimes you might get, here in California, the maximum is 5, but I know in Florida that there's like up to like 7 to 8 patients. And I really like about the ICU, what I really liked about the ICU was just having that sort of focus and that time to really connect with my patients and family. That being said, the patients are really sick, and working in the CVICU, um, we get patients who have just came back from surgery, heart surgery. So whether that's a heart transplant or a huge repair, a lot of the times these patients could fall off and
Mm-hmm.
quickly decompensate. And I really enjoy kind of having the expertise to make sure that not only my patient recovers, but the family knows how to um, sort of do this care at home and knows the plan moving forward, so that this patient can live as normal of a life as possible after discharge.
So the great thing I can sense with ICU is that you're there as soon as they come in and you're there until they are discharged, and you're able to kind of pass them on with the care to their family and let them know how to take care of them and continue on with the great care. My next question is, what other jobs did you apply to as a new grad nurse besides ICU? Because maybe you did apply to other jobs besides ICU.
So quite frankly, the job search is rough. And
Mm-hmm.
for new grad, so I started applying to things as early as March, and I graduated in May. So I started applying to things 2 months early, and I was already getting like things like my resume, my cover letter,
Mm-hmm.
letters of recommendations. I made sure I had those ready in like January. So
Good.
the
Yeah.
job search as a new grad nurse is, it's really about staying organized and doing the things as early as possible. And
Mm-hmm.
in my mentorship, I've actually, worked with nurses who are overwhelmed because they feel like it's so hard to find a job. And, especially during this pandemic, due to financial concerns, not all hospitals have money to train new nurses. So the job pool is even more limited. So on my own journey, I personally applied to every single hospital that had ICU
Mm-hmm.
as an option. And um, I was actually very interested also in labor and delivery. I really liked working with little babies, so I was really
Mm-hmm.
interested in L&D and NICU. So I applied to just about everything that had those as options.
Mm-hmm.
And I really recommend for new grads searching to apply to a formal residency program. That's what I'm currently in. And the great part is you have like sort of a portion where you're, spending some time learning new material, but you also are paired up with a preceptor, and you have that like guidance when taking care of your patients. That being said, I started doing career coaching because I've been there. I would say I submitted about 200 applications,
Mm-hmm.
did about 15 interviews, and had about 7 job offers. And, it just came down to really patience and knowing what I want.
Mm-hmm.
But I definitely feel that when you're doing that job search, just making sure, um, and this is for nursing students out there who are still in school, is treating every rotation as an interview and
Mm-hmm.
making those connections now. Like, it's okay to drop off your resume to the nurse manager or let the nurse you're shadowing for the day that, hey, like, I'm looking for a job, I'm graduating soon. And
Mm-hmm.
starting to network early, because most of the jobs that I received, it was always because I knew someone who either worked there or
Mm-hmm.
I knew of someone who could connect me. And that's, I think, what can help you get that interview. Because I almost felt like a lot of the times I was just applying and applying and applying, and to get past that sort of application period where you're waiting to hear back, um, at those places, I definitely had some sort of connection.
Yeah, that's amazing. I'm so glad you got your dream job, but it does require a lot of patience and not to expect things to come so soon and quickly, and don't get your hopes up if maybe you don't get a call back from somewhere.
The
Yeah.
last thing I'll say is I held out for my dream job. So I
Mm-hmm.
went to school with two of my best friends who went to nursing school. we graduated during a pandemic, and I mean, we're not calling it a recession right now, but
Yeah.
we're in a recession, at least in the US, because of what's going on. That being
Mhm.
said, you'll have different degrees of risk.
Mhm.
I knew what I wanted. I wanted to be in the ICU, and I was willing to wait. And
Mhm.
let me tell you, like, it was the hardest thing not hearing back. So just to give you again that timeline, I started job searching in March, and I didn't get my official job offer until now, until around
Wow, yeah.
mid-August. So that's almost 6 months.
Mhm.
And like just being resilient um, can go a long way. I had my friends who, didn't want to risk it. So
Mhm.
they got the first job that they could get
Yeah.
inpatient. So I have one friend who is working as a med-surg nurse, um, and I know he'll do great. But it's not, his dream job.
Mhm.
And his plan is to move hospitals after, say, 1 or 2 years. Same thing with my other friend. She got the first job that she could take. And again, when you're kind of on your job search, I think it's really important to find clarity, because at one
Mhm.
point I think I was just applying to whatever jobs.
Yeah.
And I definitely agree with quality over quantity. When you're turning in those applications, spending a little bit more time um, applying to what you want is better than sending out as many applications as you can to as many jobs that you can find.
Mhm. Yeah, definitely. And I feel like along with that too is some people may in the beginning apply to their dream job, and as soon as they don't hear back in just a little bit, they're like, okay, I'm overwaiting, and they're just gonna send all their applications and just take the first job. But I feel like maybe at this point with you now, since you already have your dream job, you're more calm. You're at a calm now, knowing that you won't have to, let's say, you're already at your dream job. So it's not like, oh, I still have to apply in the future to get here and then go there and then relive the whole stress of applying to jobs all over again, which is a really good idea to just hold it out. And when it comes, it'll come, and to not just get over with all the stresses during that time. And you're like, I need to get a job at this point. But another thing you mentioned earlier too was that you were able to apply to jobs before you wrote the NCLEX. So, so you're able to apply to jobs before you graduate, right?
So you totally are. And I think a lot of nurses don't do that. Is that
Mm-hmm.
a lot of the time the programs, they'll require your graduation date and your diploma and your license after the fact that you're admitted. So I wouldn't let you not having your diploma or RN license just yet discourage you from applying,
Mm-hmm.
because a lot of places um, have this knowledge that, hey, like, you're looking for a job and you're still in school, but once you finish, all you have to do is kind of show them, like, I completed my degree and here's my RN license. And I think I chose to start applying to March because I was about halfway through my preceptorship or my consolidation. And I think that was enough experience to
Mm-hmm.
talk about why I felt I was qualified, versus, me applying in like January when I hadn't started my preceptorship or consolidation. But I really recommend to, start looking early, and the earlier the better. But I really like that kind of like midway point between my in my consolidation slash preceptorship semester, so I can be like, I do have this experience, but
Mm-hmm.
I am still in school.
With that being said, too, once it becomes the end towards the actual NCLEX state, you're going to be already so stressed with having to study, and you still have school going on during the same time and clinicals and so much going on. So it's definitely an amazing idea to get all your resumes and your references and your cover letter done earlier so that you don't have to think about that later on and you can just start applying to jobs as soon as possible. So I heard another thing that you mentioned earlier too about one quote that I do actually love is that your nursing school clinicals is basically a job interview, and 1000% I agree with that. It's and two, you can later on apply, but sometimes if they're looking for employees, they can say, oh well, I know this person who did really good in my clinicals, and they could definitely recommend you. So that's a very great tip to go into nursing school clinicals thinking. And even for your everyday class and labs, some of our instructors are actually nurses. So in their job, if they're ever looking for someone to hire, they can just think, oh, I had someone in my class who did really great, and I know that they were really interested in this. And it's all about networking and doing the best you can in every situation and giving your 100%. And yeah, so that's really great advice for nursing students. So I really thought it would be a great activity to ask you some questions about nursing school from my Instagram followers. So I had some questions that they had for you. What was your dream nursing job? I know we kind of touched on that, but was it as soon as you were halfway through ICU that you were like, this is the one I'm interested in? Or did you have some inkling before then during the class, for example, that you were really interested in it?
So I had a couple inklings. Um, I would say definitely during my pediatric course. So I um, I work as a PD CVICU nurse.
Mm-hmm.
So it all started in like my pediatrics rotation. I was like, wow, I really like working with kids compared to adults. So that was a little bit of kind of that sense of like, maybe I enjoy this. And then I thought to myself that I was able to shadow in the PICU one of those days when I was in the pediatrics, and I loved it. And I really think it's just having exposure to that unit. But I didn't really know even during my med surg semester like what I wanted until I had sort of my peds rotation. And it kind of cemented to me like this is my dream. And then after doing my rotation in the PICU, about halfway, I was like, I would absolutely love to work as a PD ICU nurse. And I kind of formulated that, wow, like that would be my dream job. And I know that not everyone's, course is linear, but I think like really staying open to each rotation as an opportunity to getting to know yourself a little bit better, because my PD rotation was actually the semester before my consolidation or preceptorship. So if I hadn't waited and I had like, been really adamant of like, I'm going to be a mental health nurse, I wouldn't have known.
Yeah. So, along with that, I was really curious, just wondering, do you think that pediatrics definitely was something that was more competitive? I know, like, for some people, a large majority of nursing students say that they want to do labor and delivery or peds ICU and all that. So, I was wondering, do you think the competition was even harder to get into that field?
Oh, 1,000%. And I guess the way how to be competitive is to, once you know you're interested, get involved. So I actually got my pediatric advanced life support
Hmm.
well before I started in the PICU. I had gotten involved in this as a PEDS sort of crisis counselor at this organization called Crisis Text Line. So as soon as you think you know you're interested in a specialty, I would say get involved. I also joined the American Association of Critical Care Nurses as a member, and they let nursing students do that. So anything to sort of bulk up your resume and show that you are interested in the field can give you that sort of advantage when you're applying for your preceptorship or consolidation. That being said, even if you don't get the preceptorship or consolidation of your dreams, you have those things already on the sidelines that you could talk about when you are applying for those new grad nurse positions in that specific specialty. So I definitely recommend, volunteering or just getting a membership in any professional organization. And lastly, thinking about the types of certifications that you can add to your personal and career brand.
Doing anything that can make you stand out, not only in a competitive field, but also if you're just applying to any job, it's a really good advice to go out and get different experience in that field, like even if it's just volunteering or getting more credentials, so that can really make you stand out and they can say, oh, they already have this and this on their resume and we don't have to wait for them to get this, and they seem like they really want this position. It's kind of like applying to college or university or and seeing what you can do to make yourself stand out than just the average person, So having a high GPA and having all the prerequisites done, and volunteering is a really good one because they already know that you are familiar with the field. So that's really good advice. Another question that the followers had for you was, what types of self-care did you do in nursing school? Was there anything that you did specifically when you started to feel stressed that you would love to recommend to the listeners?
Yeah, so stress, I think having a list of things that really make you um, mindful. So for me, those things are meditating, breath work, um, things to calm you down. So I personally love green tea. I'm
Mm-hmm.
obsessed with matcha lattes. I also think what's helpful for other people can include journaling or watching a movie
Mm-hmm.
or even just being a little bit kinder to yourself. I think as nurses, we wish we could do everything. And I think that just slowing down and listening to what your body needs um, can really make a difference with stress management. And I think also letting go of that narrative that I'm so busy, I don't have time to do self
Mm-hmm.
care, and changing it to if I do self care, I'll actually perform better in school and I'll do
Mm-hmm.
better. And like switching that sort of mindset.
Yeah, that's definitely so true. When we take on so much, and not even just with the nursing school, but as a nurse, you just keep on building up more of the stress, and you're like, I don't have time for self care. And then that potentially can lead to burnout, which can be cured if you started in the beginning and prevented it with the self care.
I like to think of self care as an investment in yourself because
Mm-hmm.
if you unwind and if you're on your A game and you're relaxed, you will do so much better um, in studying, in testing. You will do and feel amazing, and you will feel much more energized and focused. So just flipping that mindset of self-care is not selfish, but it can
Mm-hmm.
actually help me achieve what I want to achieve, and if anything, do it better.
Exactly. Yeah. So even investing up to 5 minutes every day or 30 minutes a week just on yourself and doing things that you really enjoy, that helps you cope with different stresses, because nursing school and nursing field in general is a very stressful profession and career to go into. So it's building the foundation of knowing what kind of self-care techniques that you prefer to do, that really make your life a lot less stress, is very important. Another question the followers had for you was, Did you ever feel like quitting nursing school? Was there ever a point where you were like, I just can't do this?
feel like everyone at some point you will feel that way. Like the stress just gets to you. And I
Mm-hmm.
think um there was a period of time, I think it was during my I think it was during my med surg rotation, and I had like woke up late and like
Mm-hmm.
missed clinical, but like I got so lucky that day because my instructor actually called off. But like if that hadn't happened, I would have missed clinical a day. And I
Yeah.
think that day I just really had to think of like what is making me um what is making me what feelings are making me say this
Mm-hmm.
of wanting to give up. And it was really just feeling overwhelmed and feeling like I couldn't do it. And I think for that, for your follower that asked that question, I think
Mm-hmm.
it's just recognizing like that you can do it and that you're meant to be here, and reminding yourself of your first day of school and your purpose behind becoming a nurse. And when things get tough, just going back to your why. And for me, my why was always wanting to give others a chance at life. And I think that when the going gets tough, definitely reflecting on your purpose makes it a little bit easier to kind of get out of that frame of mind. And it helps you kind of get started with what you need to do, because I think that the overwhelm of having different deadlines and having to do X, Y, and Z, and sort of uh, not getting started is what can cause those feelings of like, this is really hard.
Going into nursing school, like you're so excited and you're so ready, and then you get into it and it's kind of like, whoa. And definitely what I always say and believe in is that passion for, I feel like every single nursing student who makes it through and gets over those hurdles has passion because they really want to become a nurse. They really see themselves helping people, taking care of people, and helping people that no longer can take care of themselves. And it's just like, that's my end goal, that's my dream, and I will do whatever it takes to get there. But during the moment, though, when you're in that moment of, can I even do this anymore? It's like you have to, like you said, remind yourself of your purpose and why you want to become a nurse, and just envision yourself helping someone, envision yourself in the hospital or wherever you want to go, and just say, that can be me if I just get through this. And if I'm struggling, just fix my ways, and I'll be a nurse in no time. I love all your answers, and that's really amazing. And I feel like all these nursing students will definitely appreciate all the advice and answers that you gave them. But I would love to grab what would be your best piece of advice for a fellow nursing student, or something that's just always been on your mind that you would love to let other nursing students know.
I would say that life doesn't have to start after nursing school. And I would say that you deserve to take care of yourself and also enjoy the moment, because personally felt like it was always, I'm going to relax or have fun after this test. I'm going to relax or have fun
Mm-hmm.
after this class. I'm going to relax or have fun after this rotation, this consolidation, this preceptorship, after I found my first job. And having this mindset of, no, I can actually enjoy life now, and I can do the self-care and focus on my health right now is the best thing I could say, because you'll it will be so much nicer to get through school, kind of enjoying the moment a little bit more, and remembering to take care of yourself.
Yeah, so I'm guilty of this, where during nursing school or during the school term, I definitely kind of paused my life in a way, and I just had like goggles of just nursing school and eat, breathe, sleep nursing school. And I feel like I kind of tuned out all the things that I needed to do, self-care, especially, and just kind of pausing my whole life and just going through nursing school. And I'm like, I'll after this exam, I'll go and see my friends. And after this exam, I'll go treat myself to this. But it's like, you can do that right now. You can do that right now and take a little part of your day and just do whatever you want because you deserve it. You don't deserve anything after the fact that you graduated, and you can't just unpause your life. You should enjoy this journey because it goes by so fast, right? Yeah, so it definitely goes by really fast, and it's like you're trying to grasp everything, but it's kind of just like slow down, enjoy the moment, and you'll get through it. But yeah, so thank you so much for being on today's podcast. I really enjoyed, and I definitely, especially feel like everyone else listening enjoyed having you on today. I'd love to know all your social medias so you can shout yourself out and where people can check you out.
So you can find me on Instagram at TheRainbowNurse, so including the. And you can also find me on LinkedIn at Earl Johns. And definitely DM me if you have questions. If you want to get my study guide, there's actually a flash sale for the next 2 weeks. And if you need anything like interview prep, resume or cover letter review, definitely reach out to me. I'm here to help. You can also find more information about me on my website at TheRainbowNurse.com.
Yeah, definitely. So if anyone has any questions, is curious, needs help with their career path, or needs the NCLEX study guide, Earl is the one to go check out. And he is so great and has so many things there for you guys to use, and has so much wise advice for all of you. Even if you're not a nursing student, if you're just curious, or if you're heading into the program and you want to know more about his journey and any questions that you may have, definitely go check him out. So thank you so much once again. I really enjoyed our discussion.
Thank you. And I hope you have a great day, and I hope everyone stays safe and healthy during this time.
Thank you all for tuning into today's podcast and listening to the life story of the Rainbow Nurse and all about his nursing journey. If you want to see some motivational and educational posts, don't forget to tune in at my Instagram at the Nurse on the Go podcast for just that. Thank you so much once again. Talk to you soon. The Nurse on the Go.